Child welfare workers play an important role supporting children in child welfare services and affected by parental substance use. These children across the developmental spectrum may have seen or heard things at home that have them feeling scared, confused, or alone. This video offers guidance for talking with children affected by a parent's substance use disorder. It's important for child welfare workers to talk with children about what they're experiencing, not only to answer their questions in ways they can understand, but also to help them feel safe and supported, and, as age appropriate, to understand what is happening with their parents. When children have no answers, they may blame themselves or feel responsible for their parents' substance use. It's important for workers to communicate honestly, gently, and at a level that children can understand. In this video, you'll see a child welfare worker use strategies that help build trust and foster healing. You'll observe the worker using appropriate and clear language while still being honest and gentle in her approach. You'll see the worker normalize the child's feelings and emotions and make sure they know they're in a stable environment. One technique you'll notice is the worker using play or drawing to encourage children to express their emotions. Workers also use tools like the 7 C's of addiction to help children understand they're not to blame for their parents' substance use. The 7 C's are: I didn't cause it, I can't control it, I can't cure it, I can help take care of myself by communicating my feelings, making healthy choices, and celebrating me. We're about to meet Molly, a child welfare worker. She's visiting Grace, a 7-year-old, and her maternal aunt, Hannah, who has temporary custody. Grace's mother, Shannon, was using opioids and experienced an overdose while Grace was in her care. Another adult in the home secured medical care for Shannon, but Grace was in the home during this incident. Shannon is currently in residential treatment for an opioid use disorder. Grace's father, Charles, hasn't been involved in her life since she was 6 months old. Hannah recently stepped in to care for Grace while Shannon receives help. Grace has been asking some questions, like why she isn't living with her mom anymore. She also has worry about her mom. Hannah and Molly want to help Grace understand that she's not to blame for her mom's addiction and try to ease her worry about her mom.
Hi, Molly. Thanks for coming.
Hi, Anna. It's so good to see you. And hello, Grace. I'm Molly. I met you a few weeks ago when you first came to stay here. Do you remember me?
Hello.
Oh, good. I'm glad to see you again. I'm here to visit and talk with you today. Is that okay?
Yes.
Change is scary, I know, and I want to make sure you're feeling okay. Would you like to sit on the couch with Aunt Hannah and me?
Okay.
You can bring your dog, too. What's his name?
Cookie.
Hi, Cookie. You're so sweet. Your aunt mentioned that you've been wondering why you're staying with her right now. Is that true?
Yeah. Mommy had to go to the hospital in an ambulance because she was sleeping and wouldn't wake up. Mommy's friend was yelling and she called the ambulance, I think. I was in my room when they came and took her to the hospital. Then Aunt Hannah came to get me and took me here to her house.
That must have been very scary for you. But I hear you were brave when Aunt Hannah came to take care of you.
The nurse stayed in my room with me till Aunt Hannah came. I was hugging Cookie really hard.
Well, I'm glad Cookie was there to help you. So you know that your mom was really sick and had to go to the hospital, but the doctors helped her wake up. You were able to see her after the hospital and see that she's okay. But she still needs some help to make her feel better. She has something called an addiction. Do you know what that is?
Not really.
Well, it's sort of an illness that changes how people feel and act.
And that's why she had to go to the hospital?
Yes, that's right. Addiction is an illness that makes your brain feel bad. Sometimes it can cause people to act differently, or they can have trouble waking up, like what happened to your mom. When people have an addiction, they need help to feel better. The good thing is that your mom is in a special place where doctors and nurses are helping her.
Did she get sick because of me?
Oh, Grace, no. It's not you at all. Mommies can get sick too sometimes, and the doctors are helping her feel better. Do you miss her?
Yeah.
Yeah, I bet. Well, they're taking great care of her there, and your aunt and I want to help take great care of you here. How are you feeling?
Scared that my mommy is gonna get really sick again and have to go back to the hospital.
It's okay to feel scared, but your mommy is taking care of herself and working really hard to get better. She has a lot of people helping her. You can always talk to Aunt Hannah or me when you're feeling scared or having other feelings that make you feel bad. We're here to listen to you and help you feel better.
Sweetheart, I'm always here for you. You can tell me anything, and I won't be mad at you for how you feel.
When can I see mommy?
Well, guess what? You'll get to visit her next week with Aunt Hannah. She's doing really well, and she told me to tell you that she loves you very much. And for a little while, you'll live with Aunt Hannah while your mom gets better. Do you like staying here with Aunt Hannah?
I do like my room and all the toys.
I'm glad you like them. What are some of the things you like to do during the day with Aunt Hannah?
I like coloring and playing with my toys. Mommy used to play with me sometimes, and now Aunt Hannah plays with me too.
How fun! And what do you like to draw?
Animals, trees, and my friends at school, and my family. I have a giant box of crayons that has every single color.
Can you show me?
Yeah, it's over there.
Would you like to draw a picture to give to Mommy? Maybe something you both like to do together.
That would be nice. We can give it to Mommy when we visit her next week. She'll love having a picture that you drew for her.
Oh gosh, baking cookies with sprinkles. We used to make them together sometimes on Saturdays.
That sounds perfect. It'll make your mom so happy when she sees it. Grace, do you have any other questions for me before I go?
No, I don't think so.
Okay. Well, I look forward to seeing you next week when you visit Mommy.
Thanks so much for chatting with her. I really appreciate it.
Anytime at all. You have my number if you need it. I also want to give you the information for a local counseling center. They have therapists trained to work with young children who have experienced what Grace has. They also offer family therapy, which could be helpful if you feel you need extra support while Shannon is completing her treatment. I can help you call and make an appointment before I go.
That would be so helpful. Thank you.
Notice that Molly used simple, age-appropriate language to explain Shannon's addiction as a sickness to help Grace understand that she's not to blame. She validated that Grace is feeling scared and explained that her mom is working hard to get better. She reassured her stability in staying with her Aunt Hannah and encouraged her to express herself through drawing. We also saw how Hannah played a role in creating a safe environment. Caregivers and child welfare workers working together can make a meaningful difference in a child's healing journey. Molly also stayed to help Hannah contact a counseling center that specializes in child and family therapy, ensuring that Hannah and Grace can receive tailored services for their own mental health and well-being. Molly helps Hannah make an appointment, providing additional support and an increased likelihood that Hannah and Grace get connected to the right services quickly.